Without further ado, I am very honored to introduce our first keynote speaker of this 2025 symposium, Dr. Traci Toomey. Dr. Toomey is a behavioral epidemiologist and a professor in the School of Public Health at the University of Minnesota. Plain and simple, her CV is very, very impressive. She is an expert in substance use control policies. She has served as a principal or co-investigator of nearly 40, I say 40 externally funded research studies focusing on substance use. Dr. Toomey is the director of the University of Minnesota School of Public Health Cannabis Research Center and the Alcohol Epidemiology Program. Want to thank Dr. Toomey for joining us and sharing her expertise. Without further ado, Dr. Toomey.
Thank you so much for that kind introduction, and welcome everyone. I'm so very happy to be here this morning to talk about policy and implementation issues related to cannabis legalization. And I will also touch a little bit on alcohol, because I don't think we should ever forget that alcohol is still a public health issue. Today, I'm hoping to cover quite a few topics quickly. First, I'll give you a little bit of an overview of the Cannabis Research Center, which we refer to as the CRC, a little bit about terminology, overview of cannabis policies and products, a little bit about what we know about cannabis and health, and use, what we're starting to learn about use by different groups, cannabis and underage youth, implementation assessments, and what we've learned from alcohol prevention. So as you can see, a range of topics to cover. First, a little bit about the Cannabis Research Center. When Minnesota fully legalized cannabis for non-medical use in 2023, they included an appropriation to establish a Cannabis Research Center in the School of Public Health at the University of Minnesota. And we have a broad charge to look at the effects of cannabis on health, on equity, decriminalization, prevention, treatment, and a range of other topics related to cannabis. And so we formally launched in the fall of 2023, and we feel we're fully up and running, and we have many, many research studies that we have launched in the last 2 years. Our goal, our mission, is to make sure that we understand the public health implication of cannabis legalization. And we really want to be a trusted source of information within Minnesota as well as beyond Minnesota, so that kind of a go-to for, what is the current research, and again, be a trusted source. We are neutral. We're not assuming there's problems. We're not assuming there's health benefits. We're trying to go in and answer the questions of, what are any positive ones, and what are any positive, any negative outcomes, and what's kind of the net result, net positive or net negative. To begin with, I'm going to say that I'm covering topics that I have been covering for a lot of different audiences. So kind of preparing for today, I was thinking, well, what do I often get asked, or what are the places that people get confused and have questions? And so I've been building some version of this presentation over the last 2 years. And so I'm hoping that it's helpful to you, but I'm going to start with a place that I realize that people just don't know the answer to some of these questions. So, you can throw it in the Q&A. How many states in the U.S. have legalized cannabis for medical use? Some of you may know, some of you may guess. What do you know, or what are your guesses? And then Mario said he would read some of the responses to me. Mario, are there any guesses so far?
Yes, I am now pulling the numbers. Some say 25, 23, or 32, 10, 15, just a guess, maybe 25, 30, 15. We have quite the range, Dr. Toomey.
So that doesn't surprise me. That's kind of the range that I'm used to. Well, I had to look up this one. For medical cannabis use. 47 states have some type of legalization for medical use. So let's go on to non-medical use. What are the guesses for how many states have legalized cannabis for adult non-medical use?
We are seeing some guesses 40, 15, 26, 23, 20, 24, 15, 20, 25. I feel like an auctioneer. I apologize.
Well, and the person who said 24 is the winner. There are
All
24
right.
states. Minnesota was the 23rd. So, and it's a moving target, I'll tell you, because, there's votes and during legislative sessions, it changes. So um, that just gives you a little bit of the context that this is really changing. And I'll give you a little bit of the history in a few slides. As I said, I do presentations quite frequently. And I ask these questions like, are you confused about the different terms for cannabis? Are you confused about different products? Do you know if cannabis is healthy or dangerous for people? What are the current federal and state laws about cannabis sales and use? And what should local communities be doing, or what can they be doing versus at the state level? And that's particularly a question I get in Minnesota. And I'll tell you, it's confusing. So if you think about cannabis and you say I'm confused, there's a reason, and that it truly is confusing. My work group, we talk about this every day. We're living and breathing issues related to cannabis every day in meetings, and we come up with questions. We help each other try to answer questions, and there's still many things we don't understand. One, it's a huge field. I get asked questions about plant biology or plant genetics, and I'm like, "Oh, that's not my area. I'm a public health professional." And so we just have to draw on expertise from so many different areas to try to figure out and grapple with what does it mean with the legalization of this substance. I'm going to start with some definitions of different terms, just so that we're all on the same page. First of all, let's take on this issue of, is it marijuana or is it cannabis? Cannabis is a scientific term, and many of us are moving towards the use of cannabis versus marijuana. And that's because the term marijuana, that was a term popularized in the early 20th century, but it's falling out of favor because there's really racist underpinnings behind it. And so still, we hear people saying medical marijuana, and there are some communities that still prefer to use the term marijuana. However, as scientists, we are using the scientific name cannabis, and that's even complicated, as I'll explain, because there's different forms of cannabis. So you'll hear things like cannabis sativa, cannabis indica. These are scientific plant names. These are, you think about different types of tomatoes. Well, these are kind of different types of cannabis plants. You'll hear, and I'll tell you, I have a speech issue. So sometimes my tongue gets stuck. Kind of complications, long story of a cold, but I'm going to try my best to say this. Tetrahydrocannabinol, better known as THC, and that's how I'll refer to it the rest of today. And that's the main psychoactive component in cannabis. So when you hear people getting high, the high is caused by some form of THC that comes from the plant. Now, a complicating factor is we have plants that are kind of under the hemp cannabis, and then there's some that are under what is more typically thought of as marijuana and cannabis. With hemp, it's a type of cannabis plant that historically was cultivated and used as a fiber source. So when you hear of clothes being made out of cannabis or hemp, that's the type of plant that is being used to create ropes and materials. And that hemp plant, that type of cannabis plant, is lower in THC. The marijuana, the typically what's known as marijuana plant, that type of cannabis is a cannabis plant that's higher in THC and is used and historically has been used as a drug. So kind of keep those terms in mind as we go through today's discussion. With THC, again, that's the type that's the component of the plant that gets people high. What's complicating is that there's different types of THC that is in existence. With what we historically have thought of as marijuana, that THC that we are talking about usually has been delta 9 THC, and it's found in significant amounts in some types of cannabis plants. Then we have the delta 8 THC and the delta 10 THC, and then there's other new THCs that are being found and discovered. But I think I looked up what was happening in Nebraska, and it sounds like some of the delta 8 products are showing up in Nebraska. And these types of delta THC are found in smaller amounts in the cannabis plants. There's usually higher amounts of the delta 9 THC, but the delta 8s and delta 10s are being extracted and concentrated. So that's why they're called semi-synthetic products. And you also hear of CBD, another component of the cannabis plant that is not psychoactive. However, people are taking the CBD from the hemp plant and concentrating the delta 8 and delta 10 THC from the CBD and from the hemp plant. I'm also not a chemist, by the way, so learning about the components of the plant is interesting because it is a complex plant. Further complicating or further reasons why some of you may feel confused about cannabis in the discussions is that there are different types of cannabis products, and it's a changing market. So new products are being developed, and there's multiple ways to use these products, and the different products have different types of THC and different levels of potency. When we talk about methods of using cannabis, historically, when you think of people using marijuana, it's been typically smoked, right? Smoking flower, using bongs, pipes, and joints. More recently, we hear of more people eating and drinking it. Now, historically, that's been true too. People have made their brownies and ate their THC, but it's becoming more prevalent now. The gummies, the brownies, the beverages, etc. People will vape cannabis oil using pens and cartridges or carts. And then you might have heard something called dabbing, which are high potency concentrates that are ultimately, well, I have a slide to explain that better. With the flower, it's a raw plant material, and flour is used to make edibles, put into, through this extraction methods, put into gummies and baked goods, etc. In Minnesota, we're considered the THC beverage capital. They're everywhere here. I can talk a little bit about that. And then we have these concentrates, which are oils, wax, or resin. The high potency concentrates are like something called shatter, which is solid substance that can look like rock candy. And then there's wax, which is usually soft and a sticky substance like honey. Other terms for you may hear are butter, butane, hash oil, or BHO. And a dab of these products is heated using a torch or water bomb, and then the vapor is inhaled. Now, keep in mind that when we talk about that THC concentration, and I'm going to particularly be talking about delta 9, which is what, again, has typically been the THC that has been used to get people high. It's changing the potency level. So with flour, if you knew people who were using flour in the 1970s through the 1990s, the typical potency was 2 to 5%. Today, the typical potency of flour is 15 to 20%. Now, if we look at the edibles and beverages, it's going to vary. It's really going to vary across states because some states like Minnesota put some limits on it, but you might see something typically in the 5 to 10 milligrams per serving. So sometimes a little bit lower potency. And then we have concentrates where the potency can be very, very high, with oils 40 to 60%, and with wax, shatters, and others 40 to 90%. So very large continuum of levels of potency. And in general, the potency of products is getting higher. So we also have to understand that the way people are using these products will affect how people get high and how high they may get. So it's tied to the potency, but also just the way the method they're using. So when people smoke or vape cannabis, they will most likely have an immediate intoxication effect. And this will help also people to kind of manage it. They start to feel high, they stop smoking or they stop vaping. The full effects usually peak at about 30 minutes. In contrast, if you're eating or drinking cannabis or THC, the intoxication is delayed. The start of it is delayed. So you may not feel something for 30 minutes to up to 2 hours. And the effect will last several hours with the peak at about 4 hours. And this is because, with smoking and vaping, you're going through your lungs. With eating and drinking, is going through your digestive system. So I say this because it's an education factor for anyone who's using it or for public health to get out to people. I've talked with people who had one gummy and didn't feel any effect right away. And they wanted to have an effect. They wanted to go to sleep or whatever, for whatever reason they were using that gummy. And so they take a second gummy. Well, if people do that with their beverages or their edibles, they may overconsume because that effect is delayed and it's not going to hit them for a while. With dabbing high potency concentrates, the there's immediate intoxication effects, and there are generally greater intoxicating effects per dose. So a stronger hit. So the other factor, I talked with a pharmacist who's on our campus, and she looks at, kind of individual level effects. And in addition to the different types of products, the different potency, the different methods of use, it's also complicated because each individual will have different effects. So I can use the same product as someone else, and the effects will be very different and less predictable than with alcohol. We know there's differences across body types and gender from a biologic perspective, body fat composition, et cetera. But it's even more variable with effects of THC. And so that's a little bit harder then to predict for people. She also was talking about the effects of food, particularly with edibles and beverages, and it may be different. We're still learning. But with alcohol, if you have consumed something, you might have fewer effects, like if you have fat content, where it might be the reverse effect with cannabis. So there's still so much that we need to learn to understand this product. It's because there's limits on the types of research that has been able to be conducted with cannabis, which contributes to the lack of knowledge, but also just the changing products and times. When I became the director of the Cannabis Research Center in 2023, one of the things that I wanted for myself as well as for our center is to grapple with what do we know about health risks or health benefits with cannabis. And I'll tell you, I was surprised. I actually thought we knew more and knew more conclusively. And I would say with most things are not conclusive, we're still learning. We know more about some types of health outcomes than others. With this slide, I'm just trying to summarize kind of like where we have some evidence that there may be worsening of schizophrenia symptoms with cannabis use. Use during pregnancy may lead to lower birth weight of infants. Use during pregnancy and while nursing may affect brain development of the fetus and the baby. There may be breathing problems when people are smoking cannabis and irritating their lungs. There may be increased heart rate and maybe a risk of heart attack, particularly among those who are at risk for heart disease. More frequent use increases risk of problem cannabis use. That's a pretty strong statement. But you notice I didn't use may. I think that there's quite a bit of evidence for that. And there's evidence that regular long-term use may lead to a syndrome that causes regular cycles of severe nausea and vomiting. And I'll address that in another few slides. There's growing literature related to high potency products, but again, much to be learned in this area. It appears to increase risk compared to lower potency products for mental health issues, including acute anxiety and psychosis and cannabis use disorder. And then we're particularly worried about these high potency products and other cannabis for youth and young adults up to age 25 because they're particularly vulnerable because of their brain is still developing. I mentioned the vomiting. So this is cannabis hyperemesis syndrome, or CHS. It's kind of growing understanding of it is showing up in ERs with this episodic vomiting, likely associated with high potency products, seen among those with regular long-standing cannabis use. So these are really the heavier users. Increased prevalence in recent years, and there's not specific prevalence estimates. Still much to be learned about this. The good news is it does appear that there's relief when there's sustained abstinence. We also, as I said, want to know, are there health benefits? And with the medical research, I thought it was going to be a little bit more conclusive than it is. And it's complex because right here I'll say that it appears to reduce chronic pain in terms of some forms of cannabis and some types of pain. So, there's different types of pain. Like if you've had orthopedic surgery and had work on bones, that's a different type of pain than if you have chronic back pain. That's more muscular. And so they're still figuring out, what forms of pain might it help? And, is it something you eat or drink? Is it a pharmaceutical version to guide people in terms of pain management? There is quite a bit of evidence that it can reduce chemotherapy-induced nausea and vomiting, particularly oral cannabinoids, which are more of a pharmaceutical version. It can improve patient-reported spasticity symptoms caused by multiple sclerosis. And for some people, it improves sleep with some types of medical conditions. But even in this area, it's complex because, as I said, they found it for some medical conditions. I have friends who say it helps them sleep. The question is, does it help get to sleep? And does it help you have good sleep? And that's a little bit of a question mark, is the good sleep part of it. So again, much to learn in this area. I will tell you, if you're thinking of using these products or you're guiding others, be cautious. Not everything is backed by research. So many health risks are assumed, not necessarily backed up by research. We're looking into things. Many health claims showing up on products, they're also not all backed by research. And the benefits and risks may vary by the type of product and the way it's being used. There's no agreed upon standard serving size, which contributes to challenges with guiding people, but also from a research perspective. And, again, there's different reactions to different products in terms of the potency, expected length of the high, et cetera. One area that I think that there is quite a bit of consensus is that there are risks for people under the age of 21. So far, when states have legalized cannabis for non-medical use, they've set a minimum age of 21 or older. So matching it up with alcohol, but with fewer loopholes than the minimum legal drinking age policies have across states. And like with alcohol, there's concerns with problems with brain development that can, with using cannabis, that can harm thinking, learning, and memory skills. The earlier people use it regularly, the more likely they are to have a cannabis use disorder. As I mentioned earlier, there's concerns about mental health issues and progression to other substances. And then for real young kids, we have concerns about the poisonings among youth who are getting access to things like the gummies and thinking they're candy and eating them and ending up in the ER. Bottom line is cannabis is an emerging field. So we're likely to see ongoing changes in policies, regulations, interpretation of policies, in changes in products. And because we are still learning, we can expect that research conclusions are going to evolve and change. And that should not surprise us because it is a growing field with a growing body of research literature. Okay, I'm going to take a sip and let everyone catch their breath because I just covered quite a bit. If we want to take any quick clarification questions, Mario, this might be a good time.
Thank you, Dr. Toomey. We have one question. Astrid Rees, how many know that the U.S. government currently holds and renews annually a current patent on cannabis plant compounds? Are you aware of that issue? And feel free to comment to the degree you're comfortable.
That is not an area of my expertise. So I'm not going to address it because I don't like to guess and lead people astray. It's a good question though. There's so many questions I get asked that I'll be upfront that I'm like, I don't know. As I said, we are learning every day. Oh, go ahead, Mario.
No additional questions.
Okay.
Well, if you
I'll
want
keep going then,
to go
and definitely, write down your questions as you're having them. We hope to have some Q&A time at the end today. Okay, so I wanted to give you a little bit of background about cannabis policies in the United States. This is another area that people get confused about, and again, it's complex. A lot of the reasons a primary policy that occurred in 1938 and another one that's related to it in 1970, where the Comprehensive Drug Abuse Prevention and Control Act, particularly 1970, restricted use of all cannabis plants. So all cannabis plants were made a Schedule 1 drug, which is the most controlled category of drugs that we have in the US. And so when I say there's some things that researchers have challenges answering, it's because cannabis has been a Schedule 1 drug. And most forms of cannabis still are classified as a Schedule 1 drug. So for researchers to look at it, it's difficult. They have to have a license. They have to have a very secure lab. They have to have safes for the products, and they can only use specific products. And I don't know if that's what the person who was asking the question is related to, is they can only use specifically approved cannabis from specific sources to do the research. In moving forward in time, California allowed medical cannabis use in 1996. And actually, I was surprised at how far back that was for California. Colorado and Washington were the first states to legalize non-medical cannabis for adult use in 2012. And as I mentioned earlier, 24 states have now legalized non-medical cannabis for adult use. This is a map from 2024 from the CDC website. It just shows you kind of the variability across the US. The dark blue are medical only cannabis programs. Kind of the medium blue is adult medical and not medical cannabis use policies. And the lighter blue are no public cannabis access programs, which includes Nebraska, Kansas, and Idaho. A significant piece of federal legislation occurred in 2018, which is the Federal Farm Bill. The Federal Farm Bill resulted in the descheduling of the hemp cannabis plant. And they defined hemp as any cannabis plant or derivative thereof that contains not more than 0.3% Delta 9 THC on a dry weight basis. So it removed hemp from Schedule 1 controlled substances, making it an ordinary agricultural commodity. This opened up the door for what we're seeing across many of the states. It opened up the door for the CBD and the extraction of the Delta 8 and Delta 10s, and resulted in some of those products showing up across the US. Some states had banned those products. Some states, like Minnesota, had put some regulations on them, and other states have no regulations on them. And the federal farm bill did not put any regulations on them. So there's no age restrictions for purchasing, no licensing system, no limitations on products that appeal to youth. I saw online that might be some issues that you're facing in Nebraska. No restrictions on types of hemp-derived THC products, no regulations on product labeling or packaging, no minimum price set, and no limitations on the amount or placement of advertising. And these are all things that we know from alcohol and tobacco control that are really important things to consider if we want to put some protections on for youth and also protections on for the general population. So as I said, Minnesota is one of the states that put some restrictions on these products. So in 2022, I remember hearing, reading the media headlines that effective July 1st in 2022, the headlines were Minnesota legalized cannabis or legalized marijuana. And that's not quite accurate. In 2022, the Minnesota legislature put some restrictions on these hemp-derived THC products. So they set a minimum purchase age that you have to be 21 or older, limited the THC content per dose to 5 milligrams, and limited the number of doses that can be sold in a single package to no more than 10 doses or 50 milligrams of THC per package. So they also put some restrictions on, advertising or packaging, that they can't have cartoon characters and those types of things that might appeal to youth. So they did not, however, put any restrictions on where these products could be sold, did not require registration or licensing to sell these products. As a result, it was like, oh, it's legal. So these hemp-derived THC products spread everywhere. So to this day, they are sold at bike shops, drugstores, certainly liquor stores, convenience stores, and all of those types of stores. But hair salons, massage parlors, a whole range of places sell them. In 2023, when Minnesota legalized other forms of cannabis, they did say that these places had to register, and then now we're moving towards a licensing system so that we can actually know who's selling them and who's not. But in the spring, with the registration list, we had well over 4,000 businesses that were registered to sell these products. So I use that as an example, but bottom line is there's just great variability in the statutory language, in the regulations and implementation of cannabis, hemp-derived THC products, as well as other forms of cannabis across the states. So as a researcher, if I'm looking what's happening in Colorado or California, I can't assume that the exact same thing is going to happen in Minnesota because the policies and the regulations are different. So it adds to the complexity of researching the effects of legalization. And I'll give you, and even in one state, it's complex to understand it. And I think the laws are becoming more and more complex. So we were the 23rd state. Our bill that legalized it was 300 plus pages long, and it went through almost every legislative committee in the process of getting passed by the legislature in 2023. But it did include things like having an age 21, minimum legal drinking age, no smoking and vaping, cannabis in multi-unit housing. People can grow at home, but there's a limit on the number of plants and the number of plants that are flowering at one time. Prohibition of use while driving or using heavy machinery. So Minnesota tried to put in some public health measures. Those measures of public health are variable across states. If you are interested in looking at some of the different policies, not all things are measured in the system, but many things are. In the Alcohol Policy Information System, or APIS, funded by NIAAA. They are tracking cannabis policies across states, as well as a long history of tracking alcohol policies across states. So another transition here is that we hope to look at what's happening in other states as well, but we are funded through a state appropriation by the state legislature in Minnesota. So we spend a lot of time trying to figure out what is happening in Minnesota. In the last 2 years, it's also been trying to gear up so that we can understand what's happening in our own state. A quick orientation to Minnesota is that we had medical cannabis pass in 2014, that 2018 Farm Bill passed. Then 2022, we had this proliferation of the hemp-derived THC products because of the regulations kind of making people aware that this was legal and happening. 2023, adult use of cannabis was legalized. We were also funded. 2024, the registration of some of the hemp THC businesses and some enforcement. And then now in 2025, we're finally starting to see licensing of dispensaries and dispensaries showing up outside of tribal land. We had a few show up on tribal land immediately in 2023. So understanding kind of that history in Minnesota, we wanted to know, well, what can we answer and what can we answer quickly? And one of the things we answered quickly was that the data is very limited. So if we look at survey data, if you look at the national data sources, within this summary, like some didn't have cannabis questions unless your state chooses to, like the BRFSS. It's an optional model. Same with PRAMS, which looks at people who are expecting and nursing. So you have to actually choose to add that module. In our Minnesota Student Survey, which replaces the YRBS in Minnesota, there are limited cannabis questions. It was like, did you use marijuana in the last 30 days? That does not help us answer what types of products and the likely potency or where are they getting cannabis. And so we have been working with various partners across the state to improve the existing surveys. And so we've added the optional models and we've just added additional questions when possible. We look at things like implementation of the policy, compliance with the policy, prevalence of use of different products, use during work, driving, sources of cannabis products, benefits, consequences of use, effects of legalization on health outcomes and effects of cannabis on health outcome, differences across groups, and then equity is something that we want to consider throughout all of our research. So quickly, I wanted to look at some of the questions that we've started to answer. So for example, how many people are using cannabis? This is from actually some national data, not specific to Minnesota, but someone in my team put this together. If you look at from 2012 to 2013 to 2018 to 2019, you can see that for youth, the maroon line, it's been pretty flat with total use from ages 12 through adulthood and adults 21 plus, you'll see that there's kind of this steady increase up since 2012, 2013. So some changes are not based on the legalization in this given state. It's just partly some of the trends that we're seeing across states. This is from data from the University of Minnesota student survey. Again, you can see the trend line since about 2007 has been constantly increasing. So again, not tied specifically to legalization in Minnesota. This is data, we've been looking at baseline data as other data are coming in. But this just shows you for cannabis, alcohol, and tobacco. Alcohol is the orange line. The aqua line is cannabis and tobacco is the green line. For all substances, we're seeing this trend going down. And so as legalization happens with cannabis, as we saw alcohol go down, we want to make sure that we're doing everything we can that the cannabis line doesn't start going up. Looking at our Minnesota Student Survey data, and again, this is baseline before legalization happened, but just looking at the Twin Cities metro area versus greater Minnesota, there was a statistically significant difference with youth in the greater Minnesota using slightly more cannabis prior to legalization. One of the things we're also looking at is what types of products they're using, and again, using national data, looking at adolescents versus adults. the great majority are smoking cannabis, but 40 to 51%, depending on the population, are eating or drinking it. Vaping is higher among youth than among adults, although a significant number of adults are also vaping. And then dabbing, smaller percent, but we still have 22 to 23% of youth and adults who are reporting dabbing, which is using the higher potency products. We conduct a survey at the state fair in Minnesota. There's a Driven to Discover building where we collect a lot of data. Looking in Minnesota specifically, and this I believe was from 2024 data, we have a higher percentage of people reporting using edibles, particularly in that 21 to 35 age group, 30 for edibles and beverages, fewer youth using the beverages. But part of the reason that we see, I think, more use of the beverages and the edibles in Minnesota compared to the national data is just that we have so many of these products available. Some other questions we're starting to answer is, where are people getting these products? Are they getting it from legal sources or illegal sources? And how easy is it for youth to use? For our college students buying it from a dealer, only 10% reported that illicit source. So at least with this population, we're seeing more from the various types of legal sources. We put this model together, adapted from our source model for alcohol, just trying to show where young people might get cannabis in Minnesota. So thinking from legal sales that go to from commercial sources that go to adults who then illegally provide, or illegal sales to underage youth, or legal sale if it's medical to underage people, homegrown sources, and then the illicit dealers and other illicit sources. And we have a brief on our website, and I'll give you that website in just a moment. And is a brief that describes this model, and it will help with data collection and also thinking about prevention, and can be adapted for everyone's own state. We look at the likelihood of illegal sales to underage people. That's building on our alcohol and tobacco work at the University of Minnesota. We hire people who are 21 or older, but judged to look 21. They attempt to purchase without an ID. We did recently nearly 300 purchase attempts. Just over 1/3 of the establishments sold to our pseudo underage buyer without checking age identification. In the first round, before registration of the hemp products in one of the cities in Minnesota, the sales rate was 56%. So we saw some improvement, but I would tell you there's great variability across type of establishment. No difference between on-premise bars, restaurants, and versus off-premise liquor stores, convenience stores, etc. But I was just talking to the person who led the study, Eileen Delahunty, and she said, doing some sub-analyses, it looked like some of these places, like the bike shops and places that aren't used to selling substances, had a greater likelihood of selling. I'm going to jump over this because we're almost out of time. I'll tell you that we also wanted to look at implementation. We surveyed local public health agencies. We surveyed school support staff to ask, what are their needs? And even in Nebraska, even though you haven't legalized medical or non-medical cannabis use, if cannabis is in your state, what are the needs of people that are in the front lines? Do they need technical assistance? Do they need additional staff time? Do they need legal guidance? And that's some of the things that we saw come up when we talked to our local public health agencies. They needed specific types of technical assistance, legal technical assistance. What kind of ordinances can they develop? Those types of questions. With the Minnesota school support staff, we asked them what kind of products they're seeing in the schools, and they're really seeing a lot of things with the carts and the dab pens and vaping devices, and then also the gummies and the edibles. And they really talked about there was a lack of training and lack of staff time, insufficient protocols on how to deal with kids who are using cannabis, lack of guidance from school districts. They wanted, there's a mandate on schools that they have to have a curriculum in the middle schools and high schools. Only 8% of the school support staff knew about this mandate that's hitting the schools, but they needed help with that. Bottom line is they wanted more help understanding what they were dealing with and how to deal with it. More of the same with this question. Bottom line, this is really important to look at what are the needs in the state and how to support the people who are doing the work. As we complete our studies, we will disseminate results in multiple ways, certainly in public scientific publications and presentations, but we're also doing project summaries and briefs that are posted on our CRC website. We also try to get information out through LinkedIn posts. So please follow the Cannabis Research Center if you want to see some of our updates. And I'm out of time. I want to make sure I have time for Q&A, but please don't forget, as you focus on cannabis, don't forget to also focus on alcohol, because we still have a lot of people that are affected by alcohol, including young people. And we may see interaction effects between alcohol and cannabis use, something we're looking at. Remember the 4 Ps: product, price, place, and promotion. Those are things we can limit for all these types of products and hopefully decrease problems related to these substances. And know what you can do at the local level. There's great differences between urban areas, rural areas. What does your state allow? There's limits for alcohol, tobacco, and cannabis. It varies by states. Know what you can do at all the different levels. And with that, I'm going to start with questions. You can just search Cannabis Research Center, University of Minnesota, and you will find us.